For this week's injury prevention information, we're going to look at the cervical spine. Now, for those that have worked with me for a while, or those in the department when we have injury prevention classes, posture is always brought up. I'm always asking, how is your posture? And it's because it plays such a huge role in how we move through life. So it's not just standing or sitting, but it's walking through the grocery store, walking with your kids to the park. It's standing on the training ground or on scene. How is your posture? Now, when you look at the cervical spine, it's so easy to be in this position, looking down at your phone or your tablet. We even get that text neck position, which is here. Once you put your phone away, once you put your phone away, how is your neck? Is it still forward or is it back where it should be? When you look at the position of your head, it would be just like if you were against a wall. So if this post was a wall, you want the back of your head on the wall, you want your hips on the wall, and the lumbar region, you're gonna have that natural curve. But that's how it should be. When you walk away from the wall, you're still nice and tall, head extending up toward the ceiling. So a few things to help with that, because as your neck is forward, all those muscles get so tight and often causes even our shoulders to go forward. So what can we do to help open them up and make it feel a little better? I'm gonna keep it real simple today, just two things. Two things to fit in your day. One is a wall angel. You're gonna go against the wall. You're gonna have your head against the wall, your shoulders against the wall, your hips on the wall, and again, abs in, ribs are in, but you will have that natural curve in your lower back. From here, you're gonna go up and down in a pain-free range of movement, trying to keep the wrists and the back of the hands on the wall. You're gonna have about 15, nice, slow, and controlled. Maybe your range of movement is here, that's okay. Again, you want it to be pain-free, up and down 15 times. From there, I'm gonna have you walk away from the wall, bring your hands to one side, tilt your head to that same side. Press down gently through that opposite shoulder. Keeping your lips slightly apart, you're gonna gaze down at the floor, back to the center, gaze up to the ceiling. Back to the center and up and switch sides. Tilt your head to the same side as the hands. Again, make sure your lips are slightly apart. You don't have to open your mouth, but just don't have the lips touching. Gaze down at the floor. And to the center, gaze up to the ceiling. And back to the center and up. Just those two things. Can you fit those in maybe 2 or 3 times during the day? So easy, it's not gonna take a lot of time. So when you're walking down the station, you pass a hallway without pictures on it. Bring yourself against that wall. Maybe you only do 10, that's okay. It's better than none, right? Do your snow angels. As you're walking away from that, stretch out a little bit, stretch out a little bit. See how it feels for your neck, for your shoulders, and hopefully it'll start getting that head back in that position that it was meant to be in. I'll see you next week.